or injustice and climate change. Every resident within that community has access to care, regardless of their ability to pay, whether you have insurance or not. And over 90% of our patients live below 200% of federal poverty levels. So in 2023, our health center served 31.5 million people. And most of the people in community health centers are, most of the employees in community health centers are actually from those communities. There are a whole lot of examples throughout the history of the program where people that are from community health center neighborhoods actually move from being a patient to an employee, and in some instances, leading the health center or going on to a career as a clinician. There are examples of even physicians that started out as patients in community health centers. And so, part of the program is really not just providing healthcare, but economic and social uplift to communities. And so in the early history of the community health center program, and we're in our 60th year now, environmental health was a big part of the programming. I can think of, particular health centers in rural areas, and one in particular in South Carolina, the Low Country area of South Carolina, where they actually found that there were patients that had intestinal worms, children that were developmentally and physically delayed in terms of their growth. And it turned out that these intestinal worms were really stunting their growth. And, it would give them pills to treat the worms, and it just wouldn't do it. They'd come right back with the worms. So they realized that it was the septic systems that were infiltrating the wells. And the county at the time, this is in the 70s, not that long ago, didn't have or wouldn't provide the resources to actually drill wells deep enough so that, the residents could have clean water and sanitation. And so the community health center actually went out and purchased a well drilling company. They did this recognizing the fact that if they didn't step in, then those services wouldn't be met. And surprise, surprise, kids came back in and they didn't have intestinal worms and they grew. So over time, the health center program, I think, evolved more to become a medical model, right? Medicaid, Medicare, funding, the sophistication of organizations kind of tracked us in that direction. Well, I can tell you now, community health centers are coming back towards that environmental focus, recognizing that it's in our legislative statute. We're authorized not only to provide medical care, but also to assure that water, air, and toxins are, or that water and air are free from toxins, and that patients can thrive in clean and healthy environments. So that's part of our mission. The second community health center in the nation, Mountain Bayou Community Health Center in Mississippi. I saw someone here from Mississippi. Yes, in the house. They saw their federal funding given directly to the community, knowing that at the time in 1965, that Mississippi as a Jim Crow state was not going to provide those resources to a predominantly Black community. So health centers have a history and a purpose of standing in the gap. So with the discontinuation of environmental justice related programs and the abandonment of impacted communities, now is the time for all of us to step up and meet the moment. But the only way we can meet the moment is to truly be with and engage with the communities that we serve. So joining me today to discuss strategies for collaborating with frontline communities are Amy Liebman, Chief Programs Officer with Migrant Clinicians Network, Verné, Qaanaaq, Boerner with the American Public Health Center for Climate and Health and Equity Advisory Board member. And also joining us hopefully today virtually is Roishetta Ozane, founder and director of the Vessel Project of Louisiana. We understand that Roishetta is having some technical issues, so hopefully she'll be able to join us today. Well, right now I'll turn it over to Amy to discuss the impact of climate change and the health impacts on migrants and agricultural workers. Amy?
Thank you so much. It's so wonderful to be here. And I have to say, it's been an amazing conference. I'm feeling really inspired, and I'm hoping that as we share some stories from the front lines, we can continue with that inspiration. So, I'm from Migrant Clinicians Network, and we are a national clinical network that works with clinicians across the country and in Puerto Rico and the Virgin Islands. And we try to look at the intersection of vulnerability, migration, and health. And we believe that we deserve a world based on health justice and equity where migration is never an impediment to well-being. This is a picture of our founding medical director, Ed Zerweste, who served thousands of farm worker families and farm workers. I always like to bring in some of the slides are offbeat. I like to bring in just some of the folks that we're talking about sometimes when they can't be here, but want to just bring Marisol to our auditorium today. And Marisol talks about the climate in this way. It's hard work because the foreman constantly rushes us. Many workers have died in the fields due to dehydration or illness. I was picking chilies once, and a woman worker told the foreman she didn't feel well. The foreman took her out of the field, and 3 days later, it was 115 degrees out, and another young woman, just 21 years old, fell ill. We saw the ambulance taking her away because she had fainted. So at MCN, we like to think of a framework that we're calling the climate impacted migrant. And essentially, just like Marisol, that's at the end of the cycle here, but I'll start with migration in Central America, for example. There are many reasons that people come to the US and people migrate. Climate, there's also poverty, violence, economic instability. But just, for instance, how many of you remember November of 2020? I know we were obsessed with COVID, but how many of you remember the 2 Category 4 hurricanes that came 2 weeks apart in Central America? 1.5 million people were displaced. Those hurricanes came after years of drought. And so basically there were millions of people that could not sustain themselves from where they were living. And that forces some people into either migration within their country or to come to the US. And there are very few legal ways to enter the US, as we're hearing very clearly. So many times, climate is a part of the journey to the US. And so many folks are forced to cross the border in very dangerous areas. The way that we have the militarization of our border, we push people out into remote areas, and they cross in the desert and they die. In 2022, we had the highest number of recovered bodies along the border, 823 bodies recovered. And that is probably an undercount. Most of those deaths were due to the heat. Now, interestingly, I don't have a number for 2023 or 2024 because the best way to stop the problem of people dying when they cross the border is to stop documenting those kinds of statistics. So we don't know anymore on a mass scale. So the climate is a really important factor when we look at heat and crossing the border. And then many of the folks who are coming to the US are coming to the US to survive and to work. And so we look at the type of work that they're doing, construction, farm work. Many of the work is outdoors, and they're once again impacted by the climate. And then we think about where they live, and we've heard a lot about that throughout the conference today, but often the dwellings of where people are staying are impacted by the climate. So the housing is vulnerable, whether they can cool off at night because they don't have air conditioning. It's vulnerable because it's not a strong structure. It's vulnerable because of where it's located. And so the climate impacted migrant from the home country of some other country besides the US, climate is pushing them to migrate. climate impacts their ability to migrate, as well as our immigration policy. And then they often work in hazardous industries where they're impacted by the environment. And then they also live in vulnerable dwellings. So that's a framework that we're thinking about at MCN, and it's really helping us frame how we're working with climate impacted migrants. And also, I think it's really important to think about not just the folks that are coming from other countries, but we also need to look at what's happening internally in our country. So I know we all heard of Katrina and Irma and Maria, but I think it's really significant to note that 40% of hurricane victims 10 years after Katrina had not returned to their pre-Katrina home. And then with Irma and Maria in Puerto Rico in 2017, this is a very conservative estimate. They estimate that over 114,000 people began to leave the island annually. And so in addition to the migrant that's crossing, we're thinking about ways to help people in their communities, whether they're a migrant to begin with, or whether they're someone who's potentially vulnerable of becoming a migrant. So what are the strategies that we can do to protect our climate impacted communities? And this is where I think the health centers, and there was a great session before this, and then Ben sort of teed us up nicely to think about what is the role that health centers can play. And this is something that MCN, together with the National Association of Community Health Centers, as a way that we began thinking about it. And one of the important roles, and we talked more about the infrastructure piece at the session this afternoon, is that community health centers have an important role in terms of addressing the climate and just looking at the infrastructure, right? Are they able to stay open during a disaster? Are they able to, where are their generators located? Do they have generators? And can their generators be backed up with solar power if there is no electricity to the health centers? And so that's a piece that's both sort of practical, but also we look at like our greenhouse emissions. And that is a really important role that community health centers can play. And then the other pieces are a little bit more outside of that infrastructure. We want to think about what is the community health center's relationship with the community? How are they integrating and looking at the resources that they have? And I'm going to spend a little bit of time talking about community mobilization. And the other piece of this is what kind of training and support do our clinicians need? What does it mean when their patient isn't going to be able to continue their care during a disaster? What kind of preparation do they need to do? What do they need to think about in terms of how that patient is going to get their medicines, how that patient might be able to complete their cancer care, how that patient might get access to their records should they have to go someplace else. And then also thinking about what are the kinds of resources that the patients are going to need? Is it in a language that they're going to understand? Is it culturally contextual so that it makes sense to them when you're talking about how to address their diabetes when they don't have an ability to take rest at work, or they don't have an ability to test their blood. And then another super important piece of this, and I think many of the clinicians in the room can relate to this, is we want to make sure that we're taking care of our clinicians who they themselves are often living in communities where there are disasters, and they are taking care of community members who are traumatized by the disaster. I'll never forget after Maria in the spring of 2018, so about 6 months later, I met a physician who was so dedicated to his community that he continued to care for everyone that needed his care while he had no roof on his house because Maria had destroyed his house. So the impact and the psychosocial support that's needed for clinicians should not be underestimated, because if we're not taking care of ourselves, we're not going to be able to take care of the patients who need the help. So I mentioned community mobilization, and I think it's a really great approach as we're thinking about ways that we can look at climate change in the community health centers. And so what is community health? What is community mobilization, and why do we need it in emergency management? And I think when we look at the history of recent experiences with disasters, when we look at where was the government for Katrina, where was the government when we experienced Maria and Irma in Puerto Rico, we were the communities there were left without the support that they needed and deserved. And then, so what was the community's response? In many cases, in Puerto Rico, for instance, the community health centers, they were the banks, they were the provider of water, they were the place where you could come in and you could plug in your cell phone once they got cell service back. So just the community is resilient and responded to this lack of government intervention or support. And I think when we look at the first days of COVID, it's very similar. And when we look at where we are right now, it's very similar. We've been here before, but we have some models and hopefully some memory of successful activities and approaches that can help us in these situations. The other thing is that our national emergency management framework doesn't always work. There's limitations and challenges, and we saw that in North Carolina, right? It's really, there is a top-down approach, and we really need to look at it from a bottom-up approach, and that's where community mobilization can play an important role. I'm not saying that like FEMA was doing a terrible job in North Carolina. There was lots of challenges, but I think that we do need to recognize that even when we had a supportive administration, there were challenges in terms of how aid is provided and how communities respond. And then the other piece of it, it's part of the community health center mission. I mean, Ben gave a great example of the wells that we were, and you know, a community health center coming in there. This is part of who they are and their mission to their community. And so there's taking a different approach that involves the community is really kind of going back to their roots in a way. So it's fairly simple, but it's about coming together with the community and the community health centers and looking at challenges and opportunities. And based on your previous experiences, what worked, what was challenging, identifying the needs and the resources. There was a really great example in the session this afternoon talking about like a cold call to a local university that it basically was able to help with their energy assessments. I mean, that in some ways it's great that they had a program that they were looking at the climate and that motivated them to do that. But like, I wasn't surprised that it was a cold call, that there wasn't a relationship there prior. And so when we were working with community health centers and we're looking at this model, they're surprised at the number of resources, whether it's schools that can be a cooling center or serve as a place, a shelter. There are businesses that are willing to help out. There's Home Depots and pharmacies that actually want to help, but like didn't know how to get involved in the moment of disaster. So there's the planning and the capacity building around it. And it's before, during, and after. It can't simply take place when there is a crisis. And that's the big piece of looking at emergency management a little bit differently. And I think the impacts that we've seen in the health centers that we've partnered with have been pretty profound in terms of their ability to manage chronic diseases like diabetes, the mental health aspect of it, at the very least, recognizing the mental health piece that's going to be there during a disaster and figuring out how to prepare for it, and then being able to offer the treatment, particularly for any infectious diseases or immediate treatment that's needed during an emergency. The impact it has on the community health center. So Maria showed community health centers that the emergency planning that they had on their shelf belonged on the shelf, because when the disaster hit, it was pretty useless. And so really thinking about the operations, the programs, the clinician role, and then what's the role of the staff and the staff needs are really important, as opposed to, you know, just some plan that's made by one person in the health center where it's not linking to all the different components within the health center and within the community. And then the impact on the community is that there's a capacity building and an empowerment piece, and a being at the table aspect of it that really we've seen have a really important impact in how the response to emergency. So we did a lot of this in Puerto Rico after Maria. And the health centers that we worked with, like, it's kind of hard to like measure some of this stuff because, like, okay, you had this disaster, they haven't had a Maria since, but they did have COVID. And when COVID hit, our community health centers that were engaging in this mobilization model actually were better off than some of the health centers that were not, because they were able to tap into those community resources, and they had engaged the community in a way where the community felt empowered to be a partner with the health center. So we did see a lot of really significant impact. And then I'll just stop here. I welcome all of you to connect to MCN. I didn't talk a lot about the clinician training piece and our clinician resources, but we're home for all the clinicians that are looking for resources and looking for help with the environment and with the climate, as well as a number of other issues that you're facing, from diabetes to cardiovascular disease. So thank you.
We really focused a lot on just the need to have communities engaged in the preparation aspect. And, you know, with community health centers having patient-governed boards, the majority of their boards are comprised of patients that live in the communities. You know, I think that's one advantage of being able to have that voice at the table. You know, one of the disadvantages we've seen is the fact that there's not a formal role within sort of the disaster response, emergency preparedness for community health centers. They sort of sit in this in-between place between the hospital preparedness program and the public health preparedness program. And so, you know, making sure that they're at the table in some of these formal processes, being part of, you know, tabletop exercises and preparation drills, and making themselves known in the emergency management community as well as in their own community with patients is so critically important. You know, you brought up North Carolina. I was thinking about Hurricane Florence that hit North Carolina. And, you know, one of the really tragic things that happened among many was that there wasn't good communication to migrant agricultural workers, particularly those that spoke Spanish. They didn't even know a storm was coming. And some of them, you know, drowned. Some of them are rescued on rooftops of barns.
No, I'm not wearing.
Making sure that their voices and their lived experiences included in that as well is really critical. Thank you, Amy. Thank you so much for what you do and being such a great partner to us. Next, we'll have Verné. Tell us a bit about her experiences in working with frontline communities in Alaska.
Ariga, uvlu lotak. That is good afternoon. How many here are from the Arctic, live in the Arctic area? There's one. Oh, I'm glad that you've been there and seen and experienced it. How about any tribal community members here? That's not surprising either. Indigenous peoples? Welcome, welcome, my relations, and happy to see you. I think I have just a few extra minutes, so with that, I'd like to take a little bit of license and teach you a little bit of Inupiaq. So I'm Inupiaq, and I'll introduce myself in just a minute, but before that, I'll start with asking you all how you are. So to ask you all, I say, Qaanaaq bisi. So that's, how are you all? If you're fine, and if you want to answer, and you're saying for yourself, you say, Nakuunga. So, Qaanaaq bisi, Nakuunga. So again, Qaanaaq bisi, Nakuunga. Beautiful to hear you all speak Inupiaq. And I feel a sense of kinship with you all. So thank you. Thank you for lifting your voices and sharing it with me. And thank you. What a privilege it is for me to be here with you all and to have this moment with you and to be able to share some of my perspectives from the Arctic, from Indigenous lens, and from a tribal lens in the United States. So with my start, I will share that Ariga, Uvanga Atiga Qaanaaq, that Yami Ruunga, Anaga Bakak, Anagorga, Qaanaaq, Datagorga, Nukun. So I've just introduced myself in the way that my family taught me. I said Ariga, that is, it is good. And I said, my name is Qaanaaq. I am from Qaanaaq, Alaska. And my mother is Bakak. My grandmother was Qaanaaq, and my grandfather is Nukun. My legal name is Verné Boerner. I am a health researcher at the Alaska Native Tribal Health Consortium, and am a fourth-year PhD student in epidemiology at Johns Hopkins University. But today I am here with you all representing the APHA Center for Climate, Health, and Equity as a board member. So very, very honored to be here with you all. That's right, I get to advance the slides. So, oh, sorry, I didn't even do that. So that's me, and this is in Kivalina. So the area that I'm from is 30 miles above the Arctic Circle. And this is Kivalina. It's one of our neighbor communities, and I have many relations in Kivalina. This year we've seen very, very late snow and ice that far north. But here with APHA Centers for Climate and Health and Equity, we have 4 main pillars, strategic pillars. That's advocacy, education, oops. I guess I have a timer on there, research and capacity. So I was really trying to keep on track earlier. So, I just, one of the big messages that I hope to impart is that we are all neighbors, and I may have to jump around this. So if I have this on an automatic timer, I apologize. But we are all neighbors, and we're in this together. We are seeing great changes across the Arctic. And I imagine that many here actually already know that the Arctic is warming at 2 to 4 times the rate of the rest of the United States. But not necessarily many know how that impacts them directly. And so I'm hoping to be able to share a little bit of that with you today. So we are all impacted by what happens in the Arctic with regards to the Arctic amplification, which includes the ice albedo effect, the melting permafrost, which releases greenhouse gases into the atmosphere, and the changing of the jet stream and ocean currents, and all of that has impacts that move from the Arctic and pushes those effects down into the lower latitudes. And so what happens in the Arctic, it affects us all. And we're seeing that with the increased extreme weather events that are happening at those lower altitudes. More extreme storms, wildfires, drought, excessive rain, in ways that it makes it much, much more difficult to mitigate. And so here you see some of the headlines. So the Anchorage scarcity of new snow since December sets dismal records. Since that time this year, this is the lowest amount of snow that we've had in Anchorage, 4.3 inches of snow. And you see the opposite happening in other parts where the Gulf Coast, the winter storm breaks new snow records. We're getting snow in Florida. Yeah. And so this has incredible impacts to us all. And so we are neighbors. And we are our family across this globe. So let me see. Oh, and this picture here. It's a paradox of beauty. It's incredible beauty. But this was taken on Valentine's Day just a couple of weeks ago. To have open water in Nome, Alaska, this is Nome, Alaska, at this time of year is exceptionally dangerous. The snow cap or the ice actually protects the community during storms and swells so that those water currents do not come up and disturb our communities and lands. And so we've seen floods in Kotzebue this winter. And so while it's so very beautiful, this was actually a word of caution sent out by my friend who took this picture, Janice Doherty. We were having a snowmobile, we call them snow machines, but we had the snowmobile race, and this was just a warning to the racers to be extra careful because we have open water out there. And so it poses real dangers to the communities. So I am charged to present some of the solutions in working with communities. And tribes are sovereign nations in the United States. And with that, we have consulted with, and we've gotten input from the tribes directly as to what they would like to see as far as responding to mitigating and dealing with climate change in our communities. So as you used your voice today, this is the tribes raising their voices and sharing with you and everyone what our priorities are with regards to addressing climate change on the front lines as tribal and indigenous communities are overburdened and disproportionately burdened with the adverse impacts of climate change overall. So the first recommendation is support tribal resilience through policy and through funding, and fund tribal initiatives. Climate change has incredible impacts on the food sovereignty and food security. As in my community, where everyone is starting to see in the United States increases for inflation for the cost of food. But in my community, over 80% of the communities in Alaska, spread across 660,000 square miles, are off a road system. Everything has to be flown in by planes, and these are small planes, 9-seaters. And so everything is flown in by plane. To access healthcare, it's often through planes, and we don't have wonderful providers like you in our communities, but we do have community health aides. And if any of you are curious about what that is, see me after and I'll share with you what community health aides are. But to think in some communities, they have to fly the distance from California to Kansas City to see a provider. So, and my grandmother was a community health aide, so she's helped mothers give birth while in the air, while flying to the healthcare hub. I still don't know where the place of birth is for that child, but those are some of the experiences that we have in tribal communities at extreme remoteness. We ask to have a seat at the table, and some of these recommendations are very similar to Amy has shared, sorry. And so having a seat at the table at all federal advisory boards, and even within non-federal, where it has impacts on tribal communities, and to build those tribal federal partnerships and enter into produced research models where it respects knowledge sovereignty for tribes and building that experience with tribes. And then tribal infrastructure priorities, including access to safe water and sanitation and electricity. Over 20% of rural Alaska homes do not have in-piped water systems. And we use a honey bucket, the 5-gallon buckets that they were talking about at Guantanamo Bay as being inhumane. That's what we use, a 5-gallon bucket as a toilet. And so in this day and age, it's absolutely astonishing. And over 70% of Alaska Native population is enrolled in Medicaid. It's astounding to me. So these are factors that we are dealing with. And in a place where billions and billions of dollars have been pulled out of the earth, and 70% of our people are on Medicaid. So here's an example of from the front lines. I'll start here. We are, the Alaska Native Tribal Health Consortium is involved with the LEO network. So those are local environment observers that connect people through information and our shared environment. So this is a map of Alaska, and these are where we have local or LEO observers or local environment observers. And these are also a lot of the rural communities. Again, 80% of these are off the road system. And again, spread across 660,000 square miles. This from this point to over here, this is the coast in Georgia. It's the coast in California. It is a vast expanse. And so, but using the local environmental observers, it tracks environmental changes locally. It combines indigenous and scientific data, and it bridges observation to action. And so I've got another example here, again from the front lines, and looking to build from local strengths, but also to build local strengths. And to build capacity overall, not just for this generation, but for the next and the next and the next. And then taking a frontline approach. So this is an example of a response after the storm Merbok hit the coast of Alaska, where many of our communities were impacted. And here is a local individual who is operating a very high-tech drone in order to measure the coastal line changes from the erosion that occurred from that storm and the damage that had occurred. FEMA learned a great deal from this process, including the fact that Alaska Native fish camps are not for recreation. Whereas in many other communities or where the federal government had fish camps and camping as recreation, fish camps are absolutely essential for food security for our peoples. Flying food from Anchorage and from the hubs into these small communities is exceptionally expensive. And so we still depend on subsistence and sustenance that come from the land for a vast majority. And it's so much more healthy for our people overall. So in closing, I just want to share that, we are working together. Climate change is not a distant threat, and many of you already know and are here because you can appreciate the threat that climate change has. But the Arctic is much closer than you think. And that tribal communities are actually on the leading edge and have been for decades because we have been experiencing climate change and the warming of temperatures overall. And these are temperature bars that go across in the Arctic, again, 2 to 4 times the rest of the United States. But everyone is experiencing that. So you see that same thing is happening in Washington, D.C. So we are all connected in that. And so thinking about sort of innovative ways and the need for innovation, we have 30 communities that are looking at managed retreat, where we actually have to move the entire communities from the coastlines to higher ground because the threat that climate change is already having in our communities. So there's a lot of opportunity for being on that leading edge and being a part of it as well. So the action that I'm hoping you all will think and consider is coming and working for us. Come join us. We have health provider shortages and health professional shortages in our tribal communities that are well documented. And so I'm just wanting to plant that seed. Come out and visit us, come out and see, and be a part of that frontline work that is happening. You definitely will make a difference. So we're asking you all to consider and support and advocate for climate resilience policies, and just planting that seed to value, integrate Indigenous knowledge. So health, climate, and justice are connected. And these temperature bars show that we are all impacted, and together we can build resistance. Arikate kulapak.
Verné, thank you so much for really just highlighting just the existential threat that your frontline communities particularly are facing right now. And also the fact that you all are mobilizing to take action. But it really is very much life or death. I mean, when you were showing that very beautiful picture, I thought, oh gosh, that's such a beautiful picture. But to realize that somebody could be out like on a snowmobile and the ice crack and all this, and nobody would know that they were, that's just awful. It's just awful. And the fact that food has to be flown in, and that the food that the fish that you're actually growing there, the risk to that would essentially put the sustainability of your ability to have like food sovereignty in your local area out of reach, out of question. Yeah, thank you so much for that. We were hoping to have Roishetta Ozane from Louisiana join us, but it doesn't look like she's been able to connect on the call today. I do want to remind everyone, we're still using the app, so please put your questions in the app. Just some, I think, so much food for thought and conversation right now. But I'm going to take the liberty to sort of ask a question, since we're really at the end of the day, almost not the last session, but close. And we need to kind of look at that elephant in the room, right? I think you've helped us see just the threat that you're facing right now. But I want to just ask both of you, how is your approach to discussing climate justice, health equity changed in this current environment? And do you have any guidance for us on the best ways that we can engage the community and support the participation of other stakeholders?
So, we've been thinking about this a lot. And so, at Migrant Clinician Network, I've spent the last 25 years really looking at, pesticides and heat and various hazards that workers face. And right now, because of our immigration policies, the hazard that's first and foremost on the minds of our communities is their survival, regarding our brutal and inhumane immigration policies. So I'm not saying that, I would never say this, that climate or environment take a back seat. What I'm saying is that we can't look at these things separately. We need to really recognize that people are scared for their survival. If they're deported and sent home to some of their communities, they will die. They will either not be able to survive or they'll be victims of violence. And so that threat is so real. And what our hope is during this period, because we believe that there will be another period where we're not facing this, is that we sustain our communities and address their most immediate needs so that we can sort of begin working on the environment, on the climate, and begin addressing that. So that's one thing. And then I have a few other sort of ways that we're working around it, but I want to give you a chance to respond.
I think that is a sort of great start as well in thinking about what the threats are. And talking to some of the thought leaders and tribal leaders, one of the main points that they're raising is starting again from that local standpoint. Because if you're trying to raise your voice on this national forum, there's megaphones out there that drown a lot of us out.
Right.
But if we take that power back to our local areas and those areas where we have our voice, we use our voice, and we insist that our elected leaders represent us and bring that forward, that is one of the starting points. It's not the fastest. We'd love to have that huge and loud megaphone that is out there. But we are working with our congressional delegation. We are working with our local elected folks, and we are talking about those direct impacts to us, and holding them accountable for representing our voice and that we bring forward in that. And so that's one of the strategies that we are bringing forward, and just reclaiming that starting from the local voice and pushing it forward and hopefully creating that tide.
Yeah, I think, the common denominator in your presentations is, to me, the focus on the people most impacted, that are the folks that had the least to contribute in destroying the climate or destroying the environment. They are the least culpable, but are the greatest victims of the impact. And what I hear you saying, Verné, is they need to have the resources to be able to use their indigenous knowledge to solve the problem. It makes me think about Australia. I don't know if you remember, it was probably, somebody in here is going to correct me, it seemed like it was a long time ago, but it was probably only like 5 years ago. These massive wildfires that, destroyed, I think it was like 1 billion animals in Australia. And the wildfires occurred because of improper forest management. The indigenous people in Australia for millennia knew how to take care of the land. And they would tell the government, you need to do these certain things. And the government's like, oh, you're just you don't know anything. And it burned down because they didn't take that knowledge. And, another example where you've got, and I think it's called Leo, which, and there's a question here, is that in other parts of the country as well, because it sounds like a great model, but those people see the changes, right? So I'm a kayaker. That's the thing I like to do, right? And there's a few lakes that I kayak, pretty regularly. And I can see the changes. I can see them season after season after season. And I think people are so disassociated with the land and disassociated with what's around them that they
I have a meeting.
city just kind of go out and look at the pollen, right? I don't know if any of you are in the Southeast, but I've been in North Carolina 40 years. And I can tell you that every year the pollen is just greater and greater. And CO2 emissions contribite to, greater pollen. And I always, when my kids would ask me about it, I'd say it's really the planet trying to heal itself, right? More trees, but it's more complicated than that. But we are disassociated from our food, right? How much of our food comes from, Alaska? How much of our food is harvested by individuals that have come to this country through no other choice but just survival?
But then
And-
just to give you a little statistic, just 79% of our milk is brought to us by immigrant labor. It just, so.
Yeah.
But I just wanted to
Sure.
follow up one thing on the local piece of that, and I think that's like a lesson that I keep bringing up COVID, sorry, that we learned from COVID, but the hyper local approach to the various crises is really critical. I think that the communities understand what's happening around them, and that engagement and involvement. So this session is like from the front line, but I think that for those of us that are working nationally or addressing some of these things from a national lens, the knowledge and the participation of the community and the response is really empowering, and is going to be, I think, particularly now in this sort of lawless world that we're in, going to be the way that we move forward with climate and environment.
Mhm.
And then, so the Leo network, so the map that I had put up that showed Alaska actually didn't have the demarcation or the border from Canada, but Canada was also on there, and you saw the dots there as well. So the Leo network is international, and definitely beyond Alaska and in the lower 48. I don't know about the lower hemisphere, but it definitely is. And I think the example about COVID is a great one. So one of the recommendations from the tribes was we had an unprecedented experience where tribes were given their own jurisdiction for the COVID vaccine.
Right. Remember that.
And many, you may know, and many may not know, that American Indians and Alaska Natives suffer some of the lowest health status measures or indicators in the United States, in some cases the world, on a lot of different sort of illnesses and socioeconomic measures. When they did create that jurisdiction for that sovereign allocation for the COVID vaccine, if you looked at what happened in Alaska when the 1918 flu hit, we had whole communities wiped out, 100%, 90% of the population completely wiped out from influenza. H1N1, we were like one of the last to get the vaccines and had disproportionate impacts. But for COVID, we had a sovereign allocation. We were able to utilize those programs that we developed through self-determination and over 40 years of time with our immunization program, and tribes across the United States. When the vaccines came out, American Indians and Alaska Natives were the most vaccinated population in the United States. It just, it is such a model for being able to break those paradigms that have supported the injustice and the inequities and unequal access to care. So I think that was a great example of that as well.
So we have a question regarding migration. Migration is a form of climate adaptation. Humans have done it since the dawn of time. Animals migrate regularly. Do you think there is a way to start normalizing the conversation around migration, at least at the community level?
That's a great question. I mean, I think I used to love the topic of immigration because it crossed over like political lines. Like if we look at IRCA, which naturalized so many people in 1986, it was a bipartisan bill. And so but what has happened is that we've had these various neoliberal policies like NAFTA that forget about the movement of people. And so our immigration policy has actually like kept people in the US because it's so dangerous and treacherous to get here. And so I think that if we thought about it a little bit differently and gave people visas that they could enter and work and move back and forth and have a little bit more freedom of movement of labor, it's a really critical piece. And so, looking at it historically and how we have adapted around migration is going to be critical. And, right now there is no legal term of the climate refugee. It doesn't exist, except that millions of people are going to migrate because of the climate. So I think that's a really important piece for us to try to normalize it. And I think our approach as we move forward in this environment that we're in, and we heard a lot about the storytelling, is the humanization piece. I am shocked at the switch from our essential workers. Right, just a few years ago, they were essential workers putting food on our
Frontline
table.
essential workers, don't forget that, yeah.
And now it's like they're criminals, and so so changing that rhetoric and that conversation and normalizing migration, I think, is really critical, but also making sure that we bring in the human component of it and the constant reminder that they are human beings, because no human being can be illegal.
I just wanted to add to, some of the social constructs that have come into play and have impacted policies and such. My people are nomadic people. And it has only been in the last couple of generations where we have been forced to set structures and locations for communities. So we were forced to build and establish our towns by what the government said. They said, this is where we're putting the school, and you put your kids in school, or we're going to take your kids away from you. And so the homes where we are and those that are at threat and the infrastructure that we do have that is being impacted is also something that has been somewhat new for our peoples as well, because we would have the fish camps and for the summer harvest and the summer gatherings, and then the winter camps where we would hunker down for the winter. And so it is a different lifestyle overall, but the social constructs impacts the policies that through colonization has impacted the overall health and the security of our people.
Yeah, so I mean, what you're saying is just there's this long thread, this continuum over time that has led us to where we are right now. And we need to engage the communities most impacted to generate solutions that are going to really be able to overcome some of these issues. But we've got to have policymakers, listening to the people most impacted. We also have to have the resources so that we can plan, prepare, and adapt to, the changes that are coming. I want to thank you all so much for being on this panel. Thank you. I learned a lot. And thank you all.